Hello, good evening. My name is Dr. Trudy Ofondu of Snowspirations Global Health Solutions. Thank you and welcome to this evening's YouTube live broadcast. This evening, we're going to talk about the fastest way of achieving pregnancy before 2021 ends. So, what are the basic steps you can utilize to make good use of this beautiful structure that God gave you so you can become a mother in 2022? Today is the 17th of September. So if we begin to count down to the end of 2021, we still have October, we have November, then we have December. So we have approximately 3 months to end the month. We have approximately 3 months to end 2021. Now, this is the deal. We have approximately 14 days to end September. You can still get pregnant in the month of September. You can still get pregnant in the month of October, November, December. Now, there are specific things you can apply that might help you to achieve this objective. Now, it's my belief that when we use our motto, which is pray, play, practice, if we practice it diligently and meticulously, we will become parents. So my aim this afternoon is to give you the steps you can take so you can become a mother, a father in 2022. The 3 months remaining for 2021 to end, it's more than enough to become pregnant. Now, before I go to the key points, it's important you understand this female reproductive system. It's important you understand the individual role they play in becoming pregnant. Now, I'm going to explain the different parts so you'll be conversant while I'm making my discussion. So this is the vagina. So this is a very important part. The role of the vagina is to receive the penis. At the peak of sexual intercourse, your partner will ejaculate. Ejaculation will be inside the vagina. Now, when you go beyond the vagina, you get to the cervix. So the cervix is more like a junction between the vagina and the womb. When you go beyond the cervix, you get into the womb. So the womb is a beautiful structure where your baby will develop. This is a very strong organ. This is where your baby develops for 9 months. Now, when you go beyond the womb, you begin to get to the tubes. So you have two tubes. Now, when you go beyond the tubes, you have the ovaries. You have two ovaries. So you have one vagina, one cervix, one womb, two tubes, and two ovaries. So for you to become pregnant, your partner will meet with you, ejaculate. The content of the ejaculate is called semen. 10% of that semen contains the sperm. Those 10% of sperm is expected to be of good quality. They will enter, they will get to the womb, they will begin their upward journey to the tubes where they will meet the eggs. And if everything goes okay, you become pregnant. So this is the basic way you can become pregnant. Now to the specifics. The very first step you can take to maximize the 3 months we have so you can become pregnant fast is to study and monitor your menstrual cycle. Find your pattern. Know the normal. So the normal cycle is 21 days to 35 days. So menstrual cycle is just the interval between your two bleeding days. So when I say 21 days, it means every 21 days you will bleed. Now, 21 is the lower limit of normal. 35 is the lower upper limit of normal. So some women can have 35 days. That means every 35 days they will bleed. Now, the normal range of bleeding is 2 to 7 days. So if you are bleeding for just 2 days, that's your normal. Now, if you study and record the pattern of your cycle frequency, then you can begin to pinpoint your fertility window. Now, fertility window will work better if you are way younger. That means if you're younger than 35, you can actually apply the concept of fertility window and ovulation. But the very first step you can take to increase your chance to become pregnant fastest is to study your cycle and be used to your cycle. Now, when you're done doing that, the second step, which is practicable, is to take time. When you know your cycle, you can begin to estimate your ovulation. When you understand your ovulation using some non-specific signs, then you can begin to make sure you maximize your effort of the second part of peak, which is lovemaking, about your ovulation. Ovulation is simply the process of releasing the eggs, which you already came into this world with. Now, if we target everything properly and you are okay, your partner is okay, you still have eggs, you're releasing the eggs through the process of ovulation. If you practice PPP with good knowledge of your cycle, with good knowledge of the likely period you will ovulate, you will become pregnant. So the first two components of this method, of this way of becoming pregnant faster is what? Knowledge. Increase your knowledge base. Now, number 3 step, you have to engage in liberal sexual intercourse without protection, liberally, 48 hourly. Now, this particular step works. It works like magic. So 48 hours means giving yourself a day break, then continuing when you are not bleeding. Now, if you find it okay to also meet when you're bleeding, you also continue. So the essence of making love around the corner 48 hourly is to make sure that at any point in time in the female reproductive system, we have adequate sperm, which is good quality, which has good morphology, which can easily swim, so that anytime the egg is released, which can be haphazard, the sperm can easily fertilize the woman. Now, if you know your cycle and you know your ovulation and you are younger than 34, you can actually target making love about your ovulation. But the concept of timed ovulation or fertility window sex is not applicable to women above 35. The reason is because at 35, you are prone to have irregular period. So you might not be able to pinpoint if you are actually ovulating at a particular time. So to maximize your chance, you scatter your love making. You make it 48 hourly. When you're making love 48 hourly, you are increasing the likelihood, you are increasing the probability of becoming pregnant without taking any drugs. So if you notice, I haven't given you any drugs yet. It's still what you have within you. Now, number 4 point, which you have to put into consideration if you want to become pregnant within the last 3 months, you have to work on your body weight. You see, both for the males and the women, when your body mass index, it's outside the normal range. The normal range is 18.5 to 24.9. When you are around 27 up to 30, your chances of becoming pregnant as a woman is reduced. When your BMI is above 30, it becomes further very difficult. The same thing is applicable to the males. Now, how does your body weight and BMI affect your chances of becoming pregnant? It can affect your chances both physically, psychologically, morally, socially, because when you don't feel comfortable in your body, it's going to affect your hormones. It's going to affect your libido. You begin to lose your confidence. And when you don't have all this in store, you are likely going to have temporal infertility because you are not engaging. So if you are not meeting your partner the right way, 48 hourly, and you're still wishing to become pregnant, then you are not checking the box for things you can control because you can buy lovemaking. It's something you can easily get. It's inexpensive, it's easily available. So please make it a point of duty to work on your body mass index. Now, take your prenatal multivitamin. You see, your prenatal multivitamin is more like faith. When you're taking your prenatal multivitamin, you are activating your faith. So you're putting your first full step in that staircase without seeing the staircase, but you know that God is going to guide you to take that bold step. Now, your prenatal multivitamin is actually a preventative drug. It helps to make sure that you have adequate stores of important vitamins that will help your baby when you eventually become pregnant. So on its own merit, it's not a fertility drug, but it will help to make sure you have adequate stores of folic acid, which will help your baby's neural tubes, which is a place that the brain and the spinal cord and a couple of other nervous system forms. It will help you to develop properly so you won't have a disorder. Now, the next point you have to take, if you notice, everything I've been telling you are all based on lifestyle modification. So there is no quick fix. You'll have to work on your food. You see, majority of our problem, including infertility, is related to food. When you don't eat the right food, when you eat frequently, when you eat highly calorific food, when the quality of your food is lower than the quantity, we begin to have problems. So look towards eating balanced diet. So what's balanced diet? Virtually all the components of food, you will eat them, but you eat them in the right proportion. And you also watch your portion size. Now, you can come in this regards by trying a couple of things we've noticed that work. So you can try your intermittent fasting. You see, the concept of eating breakfast in the morning, lunch in the afternoon, and dinner in the night is actually not true. You can break your fast anytime. You can eat anytime you want to eat. But the key word is what you're eating? What are the contents? How nutritious? Are you getting enough? Are you introducing yourself? Are you exposing yourself to a lot of insulin, which can lead to insulin resistance? So work on what you eat. Now, the next point has to do with your activity level. You have to up your activity level. That means you have to engage in 30 minutes exercise every single day. You can have breaks for 2 days. You can break on Saturday or Sunday, but make it a point of duty to put in 30 minutes. You can break your 30 minutes, 10 minutes, 10 minutes, 10 minutes, or you can do it at a stretch. If you can do all this together as a couple, you will become pregnant. Now, make sure that your workouts are not strenuous. Strenuous workouts can work negatively towards stopping you from ovulating. So make sure you go for moderate workouts. Walking, running, bicycling, swimming, they are all okay. Avoid strenuous workouts. When you go for strenuous workouts, it's going to confuse your body. You're likely not going to ovulate. And when you don't ovulate, you will not have an opportunity to become pregnant. Now, be aware of age-related fertility decline. So this is where you need to apply your concept of things that might limit your ability to become pregnant regarding your age. So this is where you need to be conversant with your ovarian egg reserve. So every woman in our group who is desiring to become a mother in 2022, who wants to still become pregnant in 2021, needs to know her ovarian reserve. So this is the point you go for, ovarian reserve test. This is the first thing you have to do. Ovarian reserve is going to tell us likelihood of the quantity of the eggs you have and their quality. When you have good reserve, then we can have faith to determine the type of fertility treatment you're going to go for if you need it. But if you don't have good reserve, then we are also going to modify our treatment modality. So assuming a woman is in her 45 and she doesn't have good ovarian outcome, low ovarian reserve, what do we do at that particular point? We go for IVF. Now, when we are going for IVF at 45, we go for donor eggs. So your ovarian reserve test, it's a constant for all women who want to be pregnant in 2021. Don't just go for a blind process. You want to become pregnant, you're doing everything, but we don't have an idea of your reserve. Your reserve is subject to your age. So there are some age-related changes which can affect your ability to become pregnant, which can affect the outcome of that pregnancy. Like the older you are when you become pregnant, so from 35 up, you are classified as high risk. So you're prone to a couple of things, including miscarriage, including hypertension, including diabetes, including placenta issues, simply because of the fact of your age. So when you know all this, you will know how to approach your infertility. You will know your decision points. You will know how to make your choices based on informed consent. Now, finally, you need a fertility specialist. So one of the fastest way of becoming a mother by 2021, of achieving pregnancy in 2020, of becoming a mother in 2022 and still achieving pregnancy for the last 3 months is what? The need to get a fertility specialist. A fertility specialist is someone that went to medical school, had professional courses, took some separate course on infertility in males and female, and specializes in helping people that have problems. This is who you will need. At this stage, once you are in the category of not succeeding, naturally, you need help. You cannot lean on your understanding. So making good use of the 3 months you have remaining will culminate in getting a fertility specialist. Now, this is where we can come in handy. My organization can set you up. We can take you in. We can consult you when you subscribe, and we can set you up to meet a fertility specialist one-on-one who can take over your management based on one-on-one. So you see, our organization is a virtually based organization. So we might not see you one-on-one, but when you come in, and if you're in the location back home, we can send you to go and meet a fertility specialist one-on-one who will evaluate you and begin the treatment, and we will still co-manage you. So the use of a fertility specialist is a big advantage. Matter of fact, from statistics, members that enrolled the services of fertility specialists became pregnant faster compared to women that didn't have fertility specialists. So it's highly encouraged you employ the services of a fertility specialist if you want to get pregnant faster in 2021. Pregnancy in 2021 is still possible. Okay? All right. So I'm going to open the clinic now to take care of a couple of questions. So please ask your questions in real time and I'll provide you feedbacks. Okay? All right. It looks like we're having some network issues. Okay. All right. But ask your questions. I'm looking out for the questions so I can provide you feedbacks. If you have any questions, please feel free and ask. Okay. Okay. Are we all there? All right. Okay. Okay. The first question says, in a situation where all seems normal, yet no pregnancy, what other options are available? So when you talk about normality, normality can be relative. So what do I mean by relative? So what you might think might be normal might actually not be normal. So it's generally advised that all couples that want to become pregnant this year, you have a current lab test. So all your fertility tests must be within the last 6 months. Okay? So at least you should have done it within the last 6 months so we can review. Now, if your partner's hormone test is good, your test is good, the sperm is okay, we cannot pinpoint where the problem might be coming. That type of infertility is called unexplained infertility. It can happen to anybody. Now, in unexplained infertility, the first thing we will do is to introduce fertility drugs. So we challenge your body, give you a couple of induction drugs to take over the function of your ovaries. Then we monitor you. If that fails, we step up to IUI just by itself. If that fails, we step up with IUI with fertility drugs. If that fails, we step up with IUI with injectable fertility drugs. Then ultimately, if that fails, we go for IVF. So management of unexplained infertility is a stepwise process. Okay, Doc, do these tips still apply to couples already? Exactly the same question Chinyere asked, and you're asking. Everything I've explained, the 10 points I shared, it's matter of fact applicable to everybody. Now, this is what we know. Regardless of your duration of infertility, regardless of the cause, you can spontaneously become pregnant. So there are so many things that happen we can't explain. There are some couples that might be looking for money for IVF and suddenly they become pregnant. So regardless of if you have unexplained infertility or female factor infertility or male factor infertility, you can still apply all the tips I gave. If you notice, I didn't give any drugs. So it can work for people that have unexplained infertility or explained infertility. So it works across both the known and the unknown. Okay? All right. Please keep asking your questions so I can provide you feedbacks. My network is showing unstable. I hope I'm still able to communicate. I hope I'm still able to be heard. So if you can hear me, you keep asking your questions and I'll keep providing you feedbacks. Okay? All right. Hello, Doc. Are there sex positions that foster getting pregnant quickly? So you see, previously, a couple of people believe that, oh, there's a particular position of, love making you will assume and you become pregnant, easily. Guess what? It doesn't matter the position you assume. What we need is to make sure the penis it's right inside the vagina and you ejaculate. The key to getting pregnant is in the quality of the sperm and quality of the eggs. So once there is contact between the penis and your cervix is open, the key word is the cervix. Once the cervix is not closed, once you don't have cervical stenosis, once you don't have anti-sperm, antibodies in the cervix, there are certain things that can attack the sperm, so the sperm cannot come in. But once your cervix is good, your womb is good, the tubes are good, you can become pregnant, regardless of the position you assume in getting pregnant. So position has nothing to do with getting pregnant. Any position you want to prefer, go for it. You can become pregnant that way. Now, the same thing is applicable to the position of the womb. Some women can have forward-facing womb or backward-tilted womb. It doesn't matter if you have anteverted or retroverted womb, you can still become pregnant. So long as your womb is properly formed, you can become pregnant. Okay? All right. Doc, what's your advice for a woman who gets pregnant, but she's always losing her pregnancy at first trimester? What's the cause? Now, if this happens 3 consecutive times, that woman will be termed to have recurrent miscarriages. So if your 3 pregnancies ended in miscarriage, remember the definition of miscarriage: unintended loss of your pregnancy before 20 weeks. If it happens beyond 20 weeks, it's called stillbirth. Now, if you've had this, definitely we need to know why. So you are going to go through series of investigations. Unfortunately, the most common cause of infertility and the most common cause of miscarriages and recurrent abortion is what we call chromosomal abnormality. So the commonest thing that can lead to miscarriage, nobody can do anything about it. Now, we know other things we can control which might lead to miscarriage. So when we are doing our detailed investigation, we're going to do some advanced tests. So we're going to look at your blood, we're going to look at your urine, we're going to look at the cervix, we're going to look at the hormones, we're going to see what we can fix. So the things we can fix, we fix it. You work on your body weight, you work on your mood, you work on your eating, you work on your exercise. So management of recurrent miscarriages is based on holistic approach. So once you become pregnant, matter of fact, before you become pregnant, you're going to consult a high-risk pregnancy specialist. So your pregnancy will be closely planned. From the point of becoming pregnant to the point of delivery, we keep a close eye on you. Most women in this category, we can do a couple of preventative things. So we give you cervical sacklage to secure the cervix, even when you might have a favorable cervix. Most times when we don't really know what's going on, it's always good to go for prevention instead of trying to correct things. So if you find yourself in the category of losing your pregnancy, please don't be in a hurry to quickly become pregnant to prove yourself. Seek the help of a high-risk pregnancy specialist. There are some advanced investigations we can look at to see where we can pinpoint the problem. Because assuming the reason why you're having recurrent miscarriage is because of incompetent cervix. If we don't put sacklage on your cervix, the possibility you're going to have another repeat miscarriage is very high. So detailed investigation is very important. Okay? Is it okay to take prenatal vitamins for as long as you're believing for a baby? 100%. They are very safe. Now, the reason why you need to take this, if you're making love right now without protection, is because you don't know where you're going to become pregnant, especially if you're older than 35. So it's generally advised that women in their reproductive phase who are making love without protection should start taking their prenatal multivitamins earlier or as soon as they can. Do you know why? The period from 3 months before pregnancy and 3 months into pregnancy is the most critical period you need those vitamins, especially the folic acid. The reason is because the brain of a baby must have fully formed within that first 3 months. Remember that pregnancy is divided into first trimester, second trimester, and third trimester. So if you don't have adequate stores, if you don't take it at all, you might develop some neural tube disorder. So the reason why we advise women in their reproductive phase to take their prenatal multivitamin is because no one can predict exactly when they will become pregnant. So you might have a boy and girl relationship, and you might just be making love with your partner, thinking you can predict your cycle, thinking you're taking postinol. And at the end of the day, we've seen women that took postinol that still got pregnant. So the watchword is to take it, no matter how long. Okay, so it's not harmful. It's completely okay to take for a long time. Okay, very good question. What specifically can men do to help with infertility? Very, very important question. Now, number one, you have to pay attention. You have to show up. You have to support. You have to understand your role. You have to understand that it's a 50-50 thing. So it's not just a woman thing. You have to yield. You have to follow your partner. You have to go for your own investigation. We need to look at your spend. Then you have to change your lifestyle. Knowing fully well that you play a big role in determining what's going to happen in your family. Remember, you're the person that will determine if you're going to have a baby boy and a baby girl. So you need to start working on yourself. Your lifestyle, drinking, smoking, water, rest, eating properly. If you can work on all this, if you improve your lifestyle, by default, you're going to improve the quality of your sperm. So men can play a lot of good role as good leader, as good role model towards doing the right thing, towards encouraging the woman. Because women might emotionally have some problems, especially when you're not becoming pregnant when you want. So men can play a lot of positive role, okay? All right. How true is this from medical point of view? A woman's egg might reject the sperm. Okay, let me correct you, my dear. Now, it's not the egg. Reject the sperm. Okay, let me correct you, my dear. Now, it's not the egg. Some women have antibodies. So anytime your body is building something against what will work for your body, it's actually called autoimmune thing. So if it's your body fighting your own body, it's called auto. So auto means your body naturally is fighting your body, which shouldn't be. So in some women, it's rare, but it can happen. The body of a woman will see the sperm as a stranger, as a rival, then begin to build antibodies. So anytime you see antibodies, they are like soldiers. The same thing that can happen when a woman is rhesus negative and the baby the woman is carrying is positive, and the body of the woman will build soldiers to attack that baby in the cases of rhesus incompatibility. So the same thing can happen to some men. The body of the woman might generate anti-sperm antibodies, which will attack the sperm. Now, in some other situation, the cervix will be stenosed. So cervical stenosis means the cervix is not freely open, so it's gummed together, so sperm cannot permeate. Now, the environment in the vagina is very, very, very unfriendly to the sperm. It's acidic, so it kills a lot of sperm. But the environment in the cervix, it's nurturing, so it has some things that will help the sperm to come in. Unfortunately, in some women, they might not have this opportunity. The sperm can actually be attacked by the contents in the cervix. Okay? If weight of a woman is the cause of infertility, about BMI of 30, what can she do between now and December to get a safe BMI? This guy must be a doctor by all means possible. Now, this is what you need to do, my sister. We've noticed from research, from evidence, that when your BMI is higher, it reduces your fertility. Now, when you drop appreciably in your BMI, you increase your fertility by 10%, generally across the board. 10% increase in your fertility is a huge difference. So assuming previously you've had a BMI of 30 and you've been finding it difficult, or maybe when you even become pregnant, you lose your baby. If you work towards coming down from 30, how can you do this? Exercise, eat good food, avoid stress, avoid smoking, avoid drinking alcohol, be on the positive side of life. If you do this, if you combine your physical activity with what you eat, and you are able to bring down your BMI from 30 to about 25, which is the safe range, up to 18.5, your fertility can bounce. Now, some people can even become pregnant naturally. Some people that previously went for assisted reproductive technique, IUI, IVF, if they improve their lifestyle, they can become pregnant naturally, especially the men. The problem is women have fixed eggs. So the probability of changing the quality of egg is infinitesimal. But the probability of changing the quality of the male, it's there because sperm is produced every 3 months. So if the man can modify his lifestyle, if the woman can modify her lifestyle, when you live healthy, you are gonna put your body in a good place to release the eggs you have. So a woman that has a very good body weight will not have hormone imbalance. Hormone imbalance is one of the things that can stop you from becoming exactly who God wants you to become. So losing your body weight, crushing your BMI from 30 is generally advised across the board. So if you want to get pregnant faster in 2021, hit the gyms, go for walk. Make sure it's not strenuous. 30 minutes, moderate exercise. Going for walk every day works. If he's only walking, walk for 30 minutes every day. He walks like magic. Watch what you eat. Sleep is very, very huge. So many women are not sleeping. When you sleep, your hormones perform better. When you don't sleep, when you're stressing, your hormones are going to play tricks on you. When you combine all this with conscientious, targeted lovemaking 48 hourly, you're going to be a mother in 2022. Nothing can stop you. Look, I have seen this. It has happened severally, so I'm not moved. You're going to become a mother. You're going to become a father. This is evidence-based. If you notice, this is what I believe in. I pray, I play, and I practice. If you can do this diligently, you will be a mother, you will be a father in 2022. This is the fastest way to become pregnant naturally. If you noticed, I haven't given anybody any drugs. So the fastest way to become pregnant the remaining 3 months in this year is to take matters into your hands, is to take over, to take responsibility, to accept there are things you can change about yourself. Unfortunately, most people are looking for quick fix. You cannot become pregnant if you don't take responsibility, if you don't change your body, if you don't change your habit, if you don't begin to contribute your own, if you don't actually seek the knowledge you need, if you don't use the services of a fertility specialist, especially for women that might be perimenopausal. Some women might be perimenopausal. Perimenopausal means you are hovering around menopause. Blink in next few years, you have no eggs. So if you're perimenopausal, you definitely need the help of a fertility specialist. Okay? A woman is obsessed with getting pregnant. She gets more upset each month. Is this normal? Now, if you notice, one of my posts today talked about anger and depression. Okay? Now, infertility can damage the fabric of the strongest person out there. Okay? So the fact she's not getting pregnant on its own might be a trigger factor for whatever feeling she's having. So infertility and mental health are connected. When you easily become pregnant and you have your family, you won't be worried. But when you think you've done all your best, you've checked all the boxes, you were a good lady, depending on what you mean by good lady. Some people equate to not having, sex and boyfriend as being good. That's not my own definition of being a good lady. You might have had so many sex in the past, and currently you're a new person. Whether you had sex or you didn't have sex, doesn't necessarily affect the outcome. And look, I'm keeping it real. What I want is safe sex. Okay, making sure you don't pick sexually transmitted infection, or you don't become pregnant and you begin to go for abortion. Once you are able to practice safe sex, it doesn't matter what you did in the past. Everybody did stuff. What you need to focus on, it's in the now. Okay, so the fact she's having mood swings, the fact she's angry and all that, it's not far-fetched. Infertility can lead to depression. Infertility can lead to anxiety. Some women can also have what we call PMS, premenstrual syndrome. So women are generally function of their hormones. So some women can have mood swings. Some women can be irritable. Some women can be outrightly depressed without even knowing. And especially because we spiritualize everything. So when you exhibit all these signs, they will think you've gone crazy. They will think people in the village are attacking you. But what you need is help. What you need is medical help from a fertility specialist, and you can be calm. Okay? All right. Okay. There are foods that can help boost the chances of couples becoming pregnant faster. Yes, we actually have fertility boosting food. Now, don't go thinking that, oh, once you take it, everything will start working perfectly. It's not a drug. It will aid your body to function properly because we are all functions of what we eat. We actually have a PDF for fertility aiding food. So there are some food you're supposed to consume. They are called superfood. When you consume it, the natural ovulation that God gave you to go through will happen exactly the way God planned it. The natural pattern of your cycle will regularize. The natural pattern of the male sperm production will be normal. Nothing will be abnormal. So there are some food by default that will potentiate your fertility. I want you to understand this concept because so many people are using the concept of boosting this, boosting that to feed people poison. They package one nonsense and they tell you, oh, this is female ovarian booster, this is male this is male that. Then people begin to obsess on it. People begin to forget doing the simple things that can change their life, and they begin to focus on taking drugs. Like men that are having sperm issues. If you have low sperm count, we can give you supplements. We can give you multivitamins. But guess what? They are supplements. They are not the cure. They will help. So if you have low sperm count, what will help you better is to go for exercise, modify your life, lose your weight. Then you will see results before you blink. Okay? So thank you guys so much. I'm so happy that we were able to cover a couple of questions. My network seems to be hanging, but hopefully I was able to communicate. So remember, it's possible to become pregnant for the remaining part of this 2021 by studying and recording your cycle, finding the pattern, monitoring your ovulation, monitoring your fertility window, having regular 48-hourly sex. You can't avoid this. Working on your BMI, taking your prenatal multivitamins, eating healthy food, cutting down on strenuous exercise. Personally, I would say don't even go to strenuous exercise. Be aware of age-related fertility decline. Then ultimately, make sure you have a fertility specialist. If you can do all this, we are going to announce your baby on our platform. You know what gives me joy? When I announce babies on my platform, it gives me special joy. Now, one of our members in Italy will be going to Nigeria in a few days' time. And I tell you this, she's going to come back by the grace of God, a mother of twins. So if you need to go back to homeland, don't hesitate. If you need to cross 7 rivers, 7 oceans, wherever it takes to go and start your family, please do it today. It doesn't matter where you live, regardless of where you live. Thankfully, we have those expertise back home. So if you need help from this channel, we will always help you. Now, starting from next week, we are going to have one or few modifications. So you don't want to be left out. What I want you to do is to make sure you subscribe. So go to our notification, subscribe, click on the notification so that when the modification comes, you will always be ahead on time and you will always know when I'm coming live. The reason why I show up is to educate, to give you simple, basic knowledge, which you can use to improve your ability to achieve your family status. So I appreciate you guys this evening. Thank you for coming. Ebenezer, do we have a topic for tomorrow? If we have a topic for tomorrow, please share. If not, we're going to find another topic and we're going to continue our conversation. Thank you for coming. Enjoy the rest of your evening. Remember, when everything else fails, PPP is still there. Walk towards adopting PPP in all aspects of your life. So when you wake up tomorrow, pray to God. Thank God for giving you the ability. Thank God for giving you the mouth to complain. Do you know that the fact we even have the ability to complain is a blessing? My people, is a blessing. The fact you even have eyes to even see that you don't even have what you're praying for, it's a blessing. The fact you can even hear, the fact you can even talk, those little simple things, the fact you have people that care about you, the fact you have good friends and family is enough blessing. So let's always focus on the little things we can magnify to get our joy. But having a baby will make you complete, and God made you complete. So you're going to have all your babies, okay? So thank you for coming. And I'll see you guys tomorrow. Enjoy the rest of your evening. Bye-bye for now.